2.5 million patients infected every year. 100,000 patient deaths. 5,000 patient deaths traced to construction activity. State laws requiring public disclosure of incident reporting rates. What can you do about it? Classroom instruction, hands-on simulations with specialized equipment, and certification of construction personnel is provided by the Lakes and Plains Regional Council of Carpenters on behalf of hospitals and healthcare facilities everywhere.
It's important for a healthcare organization to hire people and companies that are trained in working in their environment, because there is literally patient life safety at stake.
Often in hospitals and other healthcare facilities, there's a facilities manager who is very aware of risk maintenance and management, and there are superintendents that take training, so they have an awareness. Unfortunately, these people cannot be everywhere.
A lot of times the supervisors, foremans will just tell their men exactly what to do, and they don't tell them the reason why. What we do is we give them the big picture. We show them exactly why they're doing things.
We have to work in a hospital that's occupied 24/7 to renovate existing spaces and also to create new spaces. We worry most about either bacteria or fungi. The bacteria we a lot of times transmit by hand, and certainly that is very much the concern of a healthcare worker. We would worry about mold, and the mold we're concerned about causes pneumonia, is Aspergillus and Aspergillus fumigatus. Organized labor approached me and felt that it was important to develop training programs for hospitals.
The training has been praised in the construction and healthcare industries and by epidemiologists and environmental specialists. Workforce education is the key to successful construction projects in hospitals. This course provides practical information needed to get the job done while helping to keep patients safe. I reviewed your workbook and was very impressed. This level of practicality is sorely needed.
One of the concerns that we have when we provide training for our contractors is to make sure that we're adding value to the contractor. And when we talk about adding value, when we have a trained professional carpenter that understands the potential risks, it's much less expensive to limit that risk at the front end, to contain it, to control it, to manage it, rather than try to fix it after the fact.
What we're finding now is that it's the rank and file that are most in need, because they're the ones with the sledgehammers and the drills and tearing the walls down, and they're the ones who will see what we're concerned about, and that is the fuzzy, moldy material that's the source. One of the things that I think the attendees of these programs really appreciate is how diverse the microbiology really is.
By providing specialized training, the carpenters and the floor coverers and other construction workers in the hospital will have an awareness that will help them do the right thing when they're making decisions during the construction phase.
The best practices in healthcare construction has been developed to meet state and federal standards and industry guidelines, including patient privacy laws.
Just knowing that the information that we might hear or run across as part of the job or inadvertently because we're in a hospital is protected information.
In there, they got to develop a different attitude. They've got to respect what the facility wants. Noise levels are real important. You know, you don't want to do anything to disturb patients.
A lot of times that procedure really supersedes production when they're in a healthcare facility. Because if you don't follow the rules, you may get it done sooner, but in doing so, you may have exposed people and patients to something that could be life-threatening to them.
One of the tools is an infection control risk assessment sheet. Determines how much you divide your construction area from the patients and the staff.
One of the exciting things about the best practices in hospital protocol is it takes some of the academic, that classroom, basic understanding, but it takes it a big step farther, and it goes into the hands-on so that the people taking the class actually have an opportunity to practice what's been discussed.
Being able to have the attendees look at equipment, be it a pop-up type barrier or a portable filter or how to assemble a zipper wall is extremely valuable.
If there's something that was said during the classroom setting that doesn't make sense when you go out into the work area to do the hands-on portion of the training, it all seems to come together.
Another tool is called a negative air machine, which actually pulls air from your construction zone and is piped directly outside. You're always working in a negative condition so that none of the dust or particles that you might be disrupting in construction get over the top or through the wall into surgery or patient areas next door.
You can't see all these things, but with this particulate counter, you can take a reading, and we've had people that have been working during the day come in and just brush themselves off and then watch the particulate level raise.
We know that in order to be the most productive worker and the best worker, that we have to continually train our members in an effort through apprenticeship program, journey person skill enhancement, specialized training like the infection prevention to make sure that we're meeting the needs of our contractors and the community. There is such a commitment within the Brotherhood for training and to make sure that we do everything necessary to meet the needs of the contractors and to meet the needs of the end user and the client, whether it's a hospital or a bank, whatever those specialized needs might be.
And that's really what we're looking for. A clean job with a minimum amount of noise and vibration, being respectful of the patient, and providing a very thorough construction project.
Classroom instruction, hands-on simulations with specialized equipment, and certification of construction personnel.
I'm proud to be part of this Brotherhood and pass that training on to all the generations to come.
When patient life safety is at stake, hire trained, skilled, passionate professionals. For certified personnel or to schedule a training session for your crew, contact us today.